All right. Kelly, I'm so happy to
Lee.
talk to you today. We have on the agenda a discussion about professional advocacy, and specifically, this recording is targeting our upcoming legislative day. We've had some discussions about the value that this might have for young professionals and students. And so, I guess to start us off, I just want to do a couple introductions of us. So, I'll start since I'm already talking. I'm Lee Coleman. I'm a delegate for the state of Wisconsin, and I've had the opportunity then to participate in state and local advocacy events, and then some federal events as well. So going to a Capitol Hill Day. And over the last several years, I've been able to take students from Concordia to our legislative days that happen on that 2 year cycle. And what we've tried to do for them is have these types of discussions to prepare us for the day. I've always found students are coming out of those days with so much energy and so much excitement. And so, again, I wanted to have this recording here today to talk about a little bit more about what the hot topics are for now. And I guess with that, I'll let you kind of introduce yourself and we'll go from there.
Yeah, Lee, no, I appreciate you asking me to do this, and I think it'll be a lot of fun. I'm Kelly Ashbeck, and I am the APTA Wisconsin Payment Specialist. I'm brand new in the role. I took over for Lynn Steffes July 1st, did about 6 months of mentoring with somebody I couldn't have handpicked a better mentor than Lynn Steffes. I'm sure a lot of those listening to this recording will know Lynn. For the students that don't, Lynn she's a rock star in our profession, and so I was lucky enough to be mentored by her. I've been a physical therapist since 2008, so I've kind of have gone down the road of trying to be the best clinician I can be. Went through an orthopedic residency program and was asked to be part of the Wisconsin APTA opioid task force. And that's where you and I actually
Yeah.
connected a few years back. And that was just, really from me going, from residency to really being involved with APTA. That was where I got the most involvement with APTA. And, since I also have my own billing and compliance company, so that gives me a lot of different perspectives. And, I think, payment, and we're going to talk a lot about payment in the next hour, but payment's just very important. Just it demonstrates the value that we have for, the healthcare for our patients. And I think, we should get paid for, how society values us.
Yeah. I love that you speak about value there, Kelly, because I started in 11 as a physical therapist, and while I didn't do a residency or a fellowship, I did went through OCS training, and I guess I always felt like the more specialized you get, the more you can kind of feel that value, the more experience you get, you feel the value you're bringing to your clients, and you can sell yourself in that way. And I think that is a struggle at times for new providers, new students, as they're seeing all these different angles that they can take and really trying to figure out and capture like what are they worth to this healthcare team and world that we live in. And I mean, I'm probably a little biased, and we both probably are a little biased, but I mean, I think we're the most valuable contributors to this world. So, to the world of healthcare, that is. And so, yeah, I really want to speak a lot about value. I think with our bill that we have that we're going to talk through, I mean, ultimately, it feels like we're getting devalued, right? And that's, I think, one of the biggest challenges that I've faced in any of these discussions with whether it's an insurance providers trying to deny coverage, or even like a legislator that we'll be talking to on the Capitol Hill. Why should we support you? And again, it's a question of value. If you're going to take resources and put them towards physical therapy, what are you going to get out of it? And I think maybe because we have this experience, we see that as an incredible value and a cost savings in the long term. And that's the message I think we're ultimately trying to get over to our lawmakers. So
Yeah, and I think, to become, I mean, it's been a while since I kind of went through the journey of applying to physical therapy school. It's not easy to get into physical therapy school, and I remember just us talking about just how difficult it was, even relative to other, graduate programs. And, I think for students now that have just gone through that, it's not easy to get through physical therapy. Of course, we end up with student debt. A lot of us, even back in 2008, we had student debt. And, coming out, even if you are, that new grad and that new, um, young professional, you still have, you know your stuff, and of course, when you gain experience, things become easier. But we were all new grads and we still brought a ton of value to the system. And, I think that for legislators to hear what value that we bring, we could talk about acute low back pain. We could talk about falls prevention. We could talk about carpal tunnel. We could talk about opioid use. We could hit so many different angles of what value that we bring. And as a new grad, you're going to bring that value. And of course, I also went through getting my clinical specialty in orthopedics. And we can talk later about, I think the importance of striving for clinical excellence. But again, we all bring something to the system, and payment as a way that, again, we are valued.
Yeah.
And we should get paid for what we do.
Right. Well, I think let's transition into some of our topics at hand. So we really have, I think, three big things we want to tackle today. Discussing the prior authorization legislation that's kind of, first and foremost for us as it's coming through the legislative cycle this year. We want to talk to the students directly about their experience or what they may experience for Ledge Day. So we've had experience, and so we want to share that. And then also potentially, like you kind of alluded to, maybe a little bit of some discussion about professional advocacy and best practice and what that kind of feels like. So any one of those you want to start with? You want to talk about the bill first? We want to talk about kind of the preview of the Ledge Day first. One of those would, I think, be.
Yeah, why don't we talk about the preview
Yeah.
of the Ledge Day? And if there are any nerves for any students, that's totally normal. I remember my first legislative day and being nervous about it. I have to get up with the lobbyists and talk for an hour and a half in front of everybody. So I'm sure I'll have some nerves that
Yeah.
day as well. Totally normal and totally okay. What I would say, for students, and if this is your first time, doing something like this, there's going to be a lot of, just kind of sitting back and listening to, listening to us talk about the prior authorization bill. There's going to be guest speakers there. Our lobbyists, Annie Early and Jeremy Shepard, they're fun to listen to.
Yeah.
And so you're going to get a lot of that before you go and speak to your legislators. And I think that, will hopefully, cut the edge if you are a little bit nervous. So that's going to be a big chunk of that first, really the first half of the day. We'll spend about an hour with our legislators, our assembly, our representatives, and our senators. And as far as I know, the senators may be on the floor that day. So we might be talking to staffers, and that's totally
Yeah.
normal to talk to staffers. Staffers are in the legislators' ears. So you're still talking to somebody of importance. And yeah, that's the gist of the day. We can kind of talk about, how to present yourself in front
Yeah.
of legislators. But if I could throw that question back at you, what has your experience been at Legislative Day?
Yeah, very similar. Again, I think it really feels like a training session in the morning and like a CE event of sorts. A lot of really exciting information coming at you. Definitely, there's a little nerves as because you're with peers, right? So so you're with a group of excited people, passionate people, and so I'm okay with that. Even sometimes, just like this, we're talking on a recording, so there's nerves that come with that. But part of, I guess, maybe the status that we have as therapists and recognizing that we do know our stuff, and certainly with a legislator or with their staffer, we are the expert in the room. And we probably are the expert in the room, we as in like our young professionals, knowing these maybe a little bit more than someone who has more experience at times because we've been talking about it so much. So that is always the case. I believe the goal of the APTA Wisconsin is to have students with some experienced licensed provider to talk to legislators. So again, if you're thinking you're going to be put on the spot and have to go one-on-one with one of your reps, that won't happen. Um, the other thing I always think about, and this kind of helps me just kind of calm my nerves, is I don't know if our group here recognizes like what happens in a writer's room, like Saturday Night Live comes to mind. And that's kind of how I think of some of these teams of legislators, right? They have staffers, they have the different members that are kind of bringing ideas to the table, and you ultimately have like whoever's the loudest voice is likely to get kind of the skit like pushed through, right? And so I think our message is such a great message. It's a fairly neutral. It's a win for certainly the voters, right? I mean, that's what a legislator. If I was thinking about running for office and wanted to get a vote, what would I want to run on? Well, I want to find things that help my constituents, right? And so when you think about prior authorization and what we'll talk about later, we're trying to facilitate care, facilitate the services to those individuals and eliminate burdens that they have experienced and that they've brought to us as providers. And so I really think it's a pretty easy sell. That might be also helping our nerves a little bit when we go talk to them. Like we're not asking for a lot of really expensive and like shiny new toys. This is kind of common sense. And I think from the last couple years, as we've discussed this, that our legislators have been very responsive to that. And
Mhm.
kind of like if they haven't heard of it before, they'll have that response like, wow, this seems like an easy one for me to sell. So I guess I would be prepared to have some head nods in these spaces and be like agreed, like we're not argumentative necessarily. And so that should be a really easy kind of experience for our students and really for all of us as we have those conversations. But why don't we then move through the prior authorization bill? We want to have like some discussion about the ask, if you will, or as we roll over from our training day at the hotel, then we'll walk across to the Capitol. We'll have our meetings set up, and we'll have a schedule for who we're meeting and when we're meeting, and we'll be talking about this bill that we'll already have heard quite a bit about because you're going to tell us about it, and I think we'll hear it from others as well. But kind of give us maybe the 2 cents, if you will, to get us a little excited about it, or a preview of what this bill for prior authorization.
Yeah, yeah, you bet. So I think one thing that I would think about as you're heading over is, we're going to go through a bunch of points right now on the prior authorization bill. And of course, you're going to have asks, to tell the legislators. But, I wouldn't want anybody to get overly nervous about memorizing every single point of the bill. I think that you're going over and you might have some personal stories or maybe something clicks and we can talk about specific issues even today. I'm sure we've got examples. I have read every single written testimony that came across, and we can kind of talk about that process as well today. But I would just say I would kind of latch on to what really sticks for you, and let the legislators know why that's important. It's your constituent, but your patients are also constituents, and patient access is a really big issue. So when we talk about prior authorization, patient access is a big part of that. We can talk about administrative burden. We can talk about all the different things that play into prior authorization. But that's one thing I would say is, as I kind of go through these points, is don't feel like you need to memorize every single point. So when we talk about the prior authorization bill, the number one point is for most issues that come in and most patients that come in, we're looking to have the first 12 visits covered without prior authorization. So I think we could talk about, why that's important and what groups would need more than that. Obviously, some are going to potentially need less than that. I think of, dizziness, vertigo, acute vertigo may only need a few visits. Legislators may ask about that. Why 12? I can tell you that during the Senate hearing, we had a hearing in front of the Senate Insurance Committee, And that was a question that they had asked. So you can anticipate that maybe they ask about that 12. And, I think just to keep it simple, most plans of care, if you kind of look at the average plan of care, you're looking at, if you talk, and I don't know if I would talk in terms of standard deviations, but we did during the committee talked about that standard deviation, and one standard deviation beyond the mean kind of gets to that 12.
Yeah.
So we don't want to kind of sell ourselves short on, would we go with 10? Would we go with 8? We want to stick with that number 12 because we feel like that hits most plans of care. The second piece is the first 90 days for folks that have chronic pain or persistent pain. I'd like to use the word persistent instead of chronic, but it's in the bill language as chronic pain. And I think for anybody that has worked with persistent pain, that makes sense as to why you would want 90 days versus, a certain amount of visits. I'm also the co-chair of the pain special interest group. And so this kind of is near and dear to my heart. Folks with persistent pain have a lot of ups and downs. They flare up during your plan of care, and that's not abnormal. They do not need to have their care delayed while they're going through the prior authorization process. Those are the folks that are going to end up in, of course, you can talk about acute pain, severe pain, and potentially needing to go to the emergency room. But these folks during their flare-ups may end up going to the emergency room. We had a patient speak during both the Assembly and Senate committee hearings, and that was part of her story, somebody that had persistent pain. And while she was waiting for her visits to be authorized, she had to go to the emergency room because of the pain that she was in. There's no need for that care to be delayed. There is, I could go on and on about the persistent pain issue. One of the things that she also talked about was, you get these mandated assessments put on you, right? So if you get 6 visits and then you get 3 visits and then you get 2 visits, this is not abnormal for us to see this in the clinic. And these patients are paying for these visits, right? These aren't free visits for them. They're paying for these visits. And instead of getting treatment, they are having to go through assessments. Some folks with quite, that may be in the midst of a flare up are having to go through these assessments, and they might be painful assessments, all to get more visits and then having to get that reassessed. So it just kind of, we want to try to clean that up.
Yeah. I would maybe just add to that too, because I know it's near and dear to you as well, but think about that persistent pain population, the likelihood that they may seek out additional pain medication, opiate. And once you do that one time, you can be in a cycle, in a spiral. And so our legislators, I know for sure, have an urgency around the opiates epidemic to try to continue to have an outward facing attack to try to make sure that we address these concerns. And this is a win for them as well, to showcase this aspect of the bill that is trying to address someone who has substance use disorder and trying to help mitigate that response. So yeah.
Spot on. Yeah. The third piece is post-operative care and not having any prior authorization during the post-operative care. Again, I've had personal experience, but in this position, I get to read all the written testimonies and seeing folks with, total knee replacement, having their care delayed and ending up with, a stiff knee when, they should have had somebody have their hands on those knees and getting them moving. And they end up with a tight knee that then requires more visits than what they would have otherwise needed. Shoulder surgeries and having that care delayed and not getting the mobility back that they need. You could go on and on about post-operative care and why that care also shouldn't be delayed. And, that if the insurance company and the payers are willing to pay for this surgery,
Right.
then what about the care that actually allows that surgery to be successful, right? And so that's we really want to make sure that we get these 3 points across, that it's the 12 visits, it's 90 days for the persistent or chronic pain, and post-operative care being
Yeah.
covered. Another piece that we're trying to get across with this bill is to make sure that if we do need authorization, so this may be down the road after the 12 visits or after the 90 days, that we get a quick turnaround of 3 business days on that authorization. That's another big issue that a lot of providers are seeing, is it may be a week, 2 weeks of care that's not, or 2 week period of time where the patient is not getting care while they're waiting for this authorization. So there is another bill, and we won't go into that bill today. You may hear about that at Legislative Day, but there is another bill that the Medical Society and physicians put forth, and that's also on that bill as well. So that's really big, is to get these turnarounds much quicker, so we don't have this delay in care.
Yeah. Kelly, can I ask
So,
you
oh,
your
yeah.
thought on, why you think prior authorization, the process is gotten to the point that it has? Like, I mean, maybe there's some assumption there, but just what do you think the other side is thinking? Like, why do they want to continue this process that's bogging us down, that's creating all this work for us, that's potentially harmful to patients? What's the incentive for the insurance companies to continue to do it?
Yeah, that's a great question. And that's probably the $1 million question. However, I think that we have some insight as to why that may be the case. And in general, they're seeing increased utilization, right? So they're seeing increased utilization of physical therapy. Is that good? Is that neutral? Is that bad? Right. But if you're looking at the bucket of, physical therapy, occupational therapy, speech therapy, chiropractic, right? That's who's part of this bill, and that's our group right now. I just read. These are the things that you get to read when you're in the payment specialist position. I just read something from CMS that was looking at just kind of general healthcare spend, and they talked about the increased utilization of physical therapy very specifically, and that dated back to 2010. So that, and they talked about the possibility of, just at that point, that we may need to consider prior authorization. Well, it's 2025 and there's no prior authorization for Medicare. In that same document, they also talked about, though, how we save money
Yeah.
on imaging. They were very specific about imaging for low back pain, right? So you see this increased utilization, and yet on the other side of your mouth, you're saying, however, you're decreasing utilization of imaging and these other costly services. So, that is going to be a biggie, that if they see increased utilization, they may well be thinking that you're over treating.
Right.
Is that the reason for it, and of course there are bad actors. There's bad actors. There's a lot of gray in the system as well. I don't think we talk, enough about. It's not always black and white medical necessity, right? Especially if you've got somebody that doesn't have the best prognosis,
Right.
again, someone with persistent pain. We won't go down that too much. But again, the payer is, from their perspective, they're going to be thinking over treatment, over treatment, over treatment. And,
Yeah.
that's part of our, striving for clinical excellence. But that's, we also have to think about that increased utilization, and that's not necessarily bad if we're saving the system money elsewhere.
Great. Yeah, I might, think too, like 12 visits aren't equal across two different patients. You might spend 12 visits or range of motion for one person, and by the 12th session in another patient, you might be working on functional optimization and getting them running and moving. So, we are skilled providers. We understand how to assess each session and continue to develop, to meet goals, high level goals. So yeah, to think that it's standard to have 12 sessions, but like not every 10 sessions is going to be the same session, right? It's going to be variable for each individual. So again, I guess our students know that, and just trying to reiterate that for everybody, that we're not trying to make it cookie cutter. by saying 12 sessions is all you get, but that if someone is struggling, if they have a poor prognosis, once you get to 12, now let's play the prior auth
Yes.
game and let's think about medical necessity and spend a little bit more time reflecting for ourselves of what best practice should look like for this and work in conjunction with the provider, the insurance provider, then to say, well, what could we potentially look at, knowing that this case is starting to become more expensive for everybody.
Yeah, and I think that's a very good point that you just made, is that we're not asking for them to get rid of the prior authorization
Yeah.
process. That is a tool that they have, and I think that we can understand at the end of the day why they have that tool. We're not asking them to get rid of that tool. However, that tool can't be it can't be a sledgehammer to our plans of care,
Yeah.
and I think a lot of times that's what it looks like, as a sledgehammer. One of the things that I brought up during the Senate Insurance Committee hearing was that just in general, we're seeing an increased cost sharing shift to the patient.
Yeah.
And that is part of, we're trying to get the copays. It's another part of our bill. We're trying to get the copays to go from specialty copays down to primary care. And again, the primary care copays are lower, as a means of funneling patients to their primary care physicians and away from specialties. That would be part of that reason. And I think we view ourselves as a profession that can save the system money, and that we shouldn't have $200 copays for patients to see us when they require a plan of care. But nonetheless, regardless of that part of our bill, there's still a cost shift to the patient. And so, if the legislator asked you, are they going to use 4 visits if they don't need 4 visits? The patient's paying for those visits.
Yeah.
So we want those copays to be lower so they can afford their plan of care, and that it's a cost shift that makes sense. But there's a cost shift nonetheless.
Yeah. Great. I was thinking of this as you were talking. I sometimes ask my students to explain their own benefits to themselves. Like, just research it. What would it cost you to go to physical therapy? What would your copay look like? How many visits do you have? And it's hard. Sometimes we don't have that. If we're healthy, we don't have that, tangible feel of what our policy is to be able to talk to it. And as I was listening to you talk, Kelly, I was thinking, how many of our legislators do you think know their own policy? Like,
Yeah,
it's complex for all of us,
it's
even for
complex.
providers.
Yeah,
So
yeah,
I wonder, I don't want you to challenge them necessarily. We want to be, friendly about it, but to just kind of, think through that, recognize for them that this can be a hard process to understand for all consumers, including us, and that ultimately this is trying to simplify it in a way.
yeah. You're right. I'll tell a story here of how complex, our own plans can be. This is back in like 2015, where I felt like I understood this, right, and I do understand it, but I clearly didn't understand my own plan, and I won't get into the details of why I had this, but I had an MRI done, and I I thought that I knew my benefits, and I ended up basically just kind of coming up with a payment plan to pay this back. Except that I just never stopped paying this bill, and I'm like, I don't am I not done paying this bill? And I reached back out to the payer, my insurance company. I said, I feel like I've got to be done. I mean, I'm not getting bills anymore, and I had this whole plan, this payment plan set up. I had I had overspent by like 1,000 or 2,000. It was a lot of money, to the point where that was the money I used as a down payment for the ring that I was buying my my girlfriend, is now became my fiance, became. So that shouldn't be that complex for
Right.
somebody that of I've always been interested in understanding these things. Of course, I'm now the payment specialist, and I've
Yeah.
had this interest. And even at that point, it was really hard to understand my own benefits. I think there's probably a reason. I'm sure that maybe that my employer was paying part of it that I didn't know. It was something
Yeah,
like that. But yeah, this is really complex for our patients to understand.
right,
And if it's hard for them to understand, yes, let's simplify this. Because what they may be seeing is that they have 20, 30, 40 visits as part of their plan, all to find out that the payer is authorizing and nitpicking everything that we are saying is medical necessity,
right.
and the payer is not viewing it that way yet. The patient is sitting and looking at their own benefits saying, well, I thought that I had X amount of physical therapy visits. Well,
Yeah,
yeah, you paid for that plan, and yet maybe you don't have that access. And
right.
yeah, it's
It's
confusing.
kind of part of the ask I know too, and just kind of as as we're learning about it, is that it feels like we're the bad guys at times because we're a lot of times the front person to showcase what the letter from, hopefully a adjuster is giving us, and not just like a, software piece of software that's sending the letter, but that an adjuster says, okay, you have two more sessions, and we're explaining that, or our reception team is explaining the benefits to the patient. Yet I know a part, maybe I'm wrong, but part of this is like this to kind of put that burden a little bit back on the person who's actually making that decision, right? To say, if you want to deny these claims, then you should do that. You should send the letter. The insurance company that is not, following through on their policy or following their policy to the standard that they have now, um, that they say, here's the benefit. So that it's a letter sent from the insurance company to both the provider and the consumer, the patient.
Yeah, and that is also, yes, you're right. That is part of the bill as well. And a lot of times we're, as providers, kind of stuck explaining this
Yeah.
to the patients during their visit. It's just it's not efficient, and that is an ask of this bill, is that the payers give an explanation to the patients as to why there is a denial, so we're not left explaining that to them.
Awesome. So yeah, that's prior auth. I mean, more to come, right? We're going to hear from some more testimony and hear from you guys at the training in the morning when we're there for legislative day. And then again, our ask is to have our legislators support this, and they may have questions for us, but I feel like we're going to be pretty well prepared to either share our own experiences or kind of just kind of tell the tale of what other patients have shared.
Yeah, yeah, exactly. And if one of the we could actually give some examples right now. And as a student, you have access to all the written testimonies. I'm not saying that you necessarily want to read through every single testimony, nor am I giving any students homework prior to legislative day. But there are some really compelling stories in there, and I think for a student that may be nervous going in and talking to legislators, to maybe hear some examples of what this can look like and why this can be detrimental to patients. For instance, we had an occupational therapist write written testimony that talked about lymphedema, and patients ending up with cellulitis while they were waiting for their visits to be authorized, right? So they're making progress in occupational therapy. Of course, physical therapists can do lymphedema treatment as well, right? And they see this progress, and then all of a sudden they're asking for visits, likely too early on in the process. The patient regresses, ends up with cellulitis, right? This is and I think the payers want at least part of this, that it's cost containment, but they want this to be quality control, right? They want to talk about this in terms of quality control. And I think legislators need to know that this process is not making things safer for patients.
Right.
We have Kevin Waite, who gave testimony, talked about, and he said, this is seared into my mind, is what he said. And it was an acute ankle sprain of a patient that was referred to them from the emergency room and was put in a boot. And you can almost, any one of us that knows kind of the pain world and what can happen when you take an acute ankle sprain and you don't move it, right? And the patient's afraid to move it. And there's a big delay in the time that the patient is referred, potentially evaluated, but there's a delay in care, and that patient ends up with a complex regional pain syndrome, which is the most painful condition you can have. So you go from an acute ankle sprain that should be a quick turnaround, right? We expect an acute ankle sprain to be quick turnaround to somebody that ends up with a complex regional pain syndrome because of this. Of course, the legislators aren't going to know what complex regional pain syndrome is, but severe hypersensitivity is what this patient ultimately ended up going through because of that delay in care, and ended up being a 9-month plan of care versus 4 to 6 weeks.
Right.
So these are the things that happen that really are detrimental to the patient. So when we want to talk about advocacy and why we do advocacy, of course we're looking at us and we're looking at our profession, but we're looking out for our patients, right? And if we truly care about our patients, these are barriers that are put up in front of our patients by the payers, and we need to fight back, and I hope that students really get that sense that this is important stuff, and that's why we're going to the Capitol talking to legislators, is that this is not efficient. This isn't fair for patients. There's a ton of administrative burden that goes into this. There's some research that says upwards of 11 minutes per prior authorization from the provider. We've got to get this fixed.
Yeah.
And I think taking those stories to the legislators, and that's, we can talk about, kind of how you present yourself to the legislator, but just be yourself and tell a story, and that's what I plan on doing. I've got the 12 points, or the 8 points, but, I think it's just telling a story. Those stories hit home. I could keep going on with stories because I've heard stories from Indiana. Indiana just recently passed legislation. I'm going to tell this one last story. Indiana passed legislation, and so we connected with them to see, how were they successful, and how can they pass that success on to us? And what they said was, there was a story. It wasn't the patient telling the story; it was the provider telling the story about a patient that was at a fall risk, and they evaluated this patient, and basically they were looking to see what the correct assisted device was going to be. They were able to get that figured out. However, they weren't able to actually teach the patient how to use this assisted device. Then there was a long delay between that first evaluation and that first follow-up visit, right? Fall risk, and we can name multiple conditions where it's very important to get them in for that first follow-up right away. Well, in the meantime, the patient fell and broke their neck. And the legislators, and I'm assuming that this was during one of their committee hearings, the legislators looked up, because these stories, this is not quality control.
Yeah.
That's not quality control. So again, we need to fight back. And, I would be okay if you're a student that's maybe a first year that hasn't seen some of these things, tell one of these stories, because they're real stories.
Yeah. The couple things that come to mind when we have already passed legislation in our state regarding falls, like trying to tackle that concern, similar with the substance use disorder population and trying to tackle that. And so we have these threads then that we've already spent money on and we have resources for, and this is just in addition to that, trying to facilitate even better care for those types of patients. So I like that. Our identity, and thinking about our value again, at the house. So at our session this summer, for the federal session, right, nationally, the APTA gets together, and all the delegates, including myself and the 8 others from Wisconsin, we talk, right? We talk big concepts. One of the concepts this year was to try to put a position statement together that talks about physical therapists being of great value and what value means. And it's such an internal debate because we, I think, identify as not wanting to be a burden and not wanting to like be so self-serving in this conversation. And I think you hit on a good point, Kelly, just to say that it's not because we want to make more money than everyone else. It's because we want to showcase our incredible skills to serve our patients. And if we can't make a fair wage to do that, then we won't be able to serve patients and we won't be able to see those downstream effects that we continually see the cost savings and the prevention of the one-off in that case. But we still have significant data about just without a cervical fracture, hip fractures, and the risk that those pose on quality of life and even mortality rates after the 2 years that it takes for someone to improve from that. So like it's still 50% mortality. It's a wild number to think about. So yeah, I really do think what this boils down to is us trying to value our worth in a respectable way to try to advocate for not only our profession, but certainly our patients and the community. And I think that community really hits home for our legislative body because that's what they're trying to do, right? I mean, they're trying to serve us as well. And yeah, so I think they like those stories that try to capture the status of the community around them.
Yeah, yeah, and also, and this is something that we have to face kind of head on as a team, and again, to kind of to explain the importance of advocacy is payers are always going to push back, trying to decrease, payments that we get per visit. We don't have to get into payment per visit, and as a student, we sometimes we just want to talk about how we serve our patients, but you know if you look at this over a long period of time and you look at just how much more costly it is to provide care and to have payers constantly push back to try to pay less and less and less and to try to add administrative burden upon administrative burden upon administrative burden, take up your time. One of the things that our small group that's been working on testimony talked about was burnout. We don't want to see these things happen. We don't want to see burnout happen. We want students to come out and young professionals, young PTs to come out and be able to see their patients, be able to have time with their patients, right? At that time is so meaningful. Oftentimes we're the ones who have the most time with these patients, who are able to tell their stories. And for some patients, that is extremely meaningful to have that time. And you can't constantly have a payer push back on you and and feel like you are spending too much time with patients when we could get in. I'm going to give examples. Persistent pain. Some of these patients have been physically, emotionally abused, and I get that that's an extreme example, but it's not that small. We'll all hear that. I've heard it many times, too many times. One of the won't get into details, but one of the worst stories that I could tell was somebody who was emotionally, physically abused, and that's a tough patient to have in front of you. They need the time to be able to talk to you, and sometimes that sense of doing cognitive behavioral therapy, just listening is a big part of that. And I know you're into the pain neuroscience and being able to explain this to patients. That time is very meaningful. And we don't need as a profession to have ourselves squeezed and watered down so much when we're the ones that are giving these patients that time.
Yeah.
And pelvic floor specialists coming out, it doesn't take much of an imagination to know what some of these patients have probably gone through. So and again, that's huge value to the system to be able to give some of those patients that time. And so when payers want to push back, we're pushing back. Then that's part of advocacy, is we're pushing back and saying, you know what, no, you're not watering down our product.
Yeah. that I was speaking a little bit earlier when the video was kind of inconsistent for us here, but basically just saying that that these participating in these events for me has been kind of a cheat code from my experience with it. It kind of helps avoid some of that potential burnout because you get the inspiration of action, right? You're trying to talk through these things. You get that shift again in your workflow instead of the patient care model of just like treat, 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 treat. You're stepping back, thinking about it. And so, for our young professionals, as we think about staying involved in advocacy, it doesn't have to be that, every day you're on Capitol Hill, banging the drum and screaming, but you're still working with your patients regularly. But taking the time to just kind of reflect and talk to, I think it's a really, really important part, at least for myself, of how I stay grounded and stay committed to physical therapy and not feeling like I get burned out. It's been a while since I've treated in a full day of just persistent pain. But man, thinking back to some of the struggles that, patient after patient after patient with those stories that are very complex, and it's no doubt why some of our providers, some of our physical therapists feel like they're, getting stretched. And again, they may be, but there's an incredible value that they're providing to that. And so we want to make sure that we continue to speak to that. Yeah. Love it.
Yeah. Yeah.
So,
I mean, that's spot on.
yeah.
Yeah.
Well, we had some other topics, Kelly. I really think we did a pretty good job of hitting the key like highlights here of making sure students, if they listen to this, feel like they got an overview of our bill and kind of the process of the day of legislative day. That again, you could have never listened to this and walked in there completely green, and you're still going to get a lot of great information and feel well prepared, I think, for that afternoon. So I hope that's the case. And then and maybe some more discussion to come and more of these discussions from us on different ways to advocate for our profession, for ourselves, for best practice principles. And I look forward to that if we get the opportunity to speak again.
Yeah, I hope so. Yeah, I think that'd be great. And I think to get back to just advocacy in general, I think just you're right. You're not going to be at Capitol Hill every day. You're not going to be in Madison every day. Nor do you have to be. I think just being in the know, being in the in the conversation, being able to give your opinions on these. It's your profession, and we strive for excellence, and I think that we should all be in the conversation as to what's going on legislatively, and what's going on at the state level, what's going on at the national level. And
Yeah.
yeah, I hope that we can continue these conversations and we can hit on different topics. And if there are questions, I want students, I want young professionals, any APTA member to reach out to myself. I can answer payment questions, but just in terms of future conversations, what do folks want to hear? Because I'd love to have the conversation.
Yeah. I think, we wouldn't be having this conversation, in my estimation, if we didn't get more out of the engagement in the APTA Wisconsin and these different things than we've put into it, right? I mean, like, I can just think back to all the different experiences I've had, sometimes just being drug along for the ride because a peer wanted to go to a PT pub night or wanted to go to Mary Pat Murray Award or something like that. And it's never, I said at the end of it, like never a waste of my time. It's always refreshing. It's people, and it's your people, right? It's your like-minded people that are in these spaces. So I know it's a lot to ask young professionals who they're already stretched with their time and their resources and everything else. But I really think the more we have, these conversations, put this out there, recognize that we're in this, we're all on the same team here, and you just get so much out of it. So I want to continue, I guess, and inspire that involvement. And
Yeah.
um,
And one thing, this is maybe a bit of a side note, but it was something that um, that to me was very meaningful. Just the last month being at the Capitol and talking through this, and it's aside from physical therapy in general, but we live in a very partisan world, and we're coming with a nonpartisan issue and with bipartisan support. and to be able to experience that. And for myself, I have a Republican representative, a Democratic senator, and I think that we all just need to take that in and see government working, and that's something that we just need to kind of soak it in, and that's been something that I've had many conversations over the last month or so, as we're really kind of pushing through this bill, how nice it is to have a nonpartisan issue with bipartisan support. And so to all the students, I would soak that in, because it's a kind of a breath of fresh air.
Absolutely. All right. Well, until next time, thank you, Kelly, so much for all your wonderful wisdom and insight. And
Yeah.
yeah, we'll
Thank you,
talk
Lee.
again
It's
soon.
awesome.
Yeah.
Yeah. I appreciate it.
Yep.
All right. Take care.